All right, this exercise works great if you're maybe struggling a little bit, posting on the front leg, having control through your follow through, as well as, having control working into a transition in your weight shift. And so the exercise is pretty simple. Get something like a nice half foam roller like this. And then you're going to be in a split stance right here. If you're a righty, you're going to have the left leg up. If you're a lefty, like Carter, you're going to have that right leg up, left leg down, so it's going to be the opposite. Get the foam roll up against the wall right here. There's a couple keys. We're going to be working in two planes. We're going to be working in this direction, but we're going to also be working in this direction. So a little bit of sagittal plane, a little bit of what we call the frontal plane going this way. So key is right here. In this plane and in this direction, what we really want to do is we're going to want to get this glute engaged. As you can see, without leaning forward or doing anything from this position, if I squeeze the glute right there, I'm going to get a little bit of a posterior pelvic tilt on this right side. Point of that is when we transition that back side right here, that glute should be activating, working this hip into extension as we transfer over. This foot right here is going to be doing kind of the opposite. We're kind of getting a push-pull mechanism as we're going into this plane right here. So this one, squeeze that glute. You'll be able to feel, everything kind of, we're going to take that pelvis and flatten it out. Then right here, we're just going to pull back. Take that heel. We're going to kind of dig the heel down to the ground, but we're also going to pull back just like this, almost like we're like the foot's glued to the ground and we're just trying to bring it back just like that. Like we're trying to pull this mat towards us on that left front foot. So we get this back glute engaged, we kind of pull that forward. We're getting kind of a scissors action going on right here. Then we throw this guy in as the final piece. Get these two going in this direction, and then we just get a nice drive into the wall. The drive into the wall is to get our adductor to fire. This hip adductor is one of the main pieces that allows to get the core engaged during that transition, but it also is one of the main pieces in terms of transferring that weight from your back to your front foot. And so we're really trying to get all the elements we can. Suck that tummy in, keep the ribs tucked. Really focus on that for a good 10 seconds, then relax. Hit that again for another 10. I would do a good 5 sets, 10-second holds. If you want to, once you get really good at, making sure you're doing everything right, squeeze the glute here, pull them back here, press it into the wall, suck that tummy in, keep the ribs tucked. Once you get that mastered, you can throw in some things right here to provide some upper body dissociation. So something like this, something where you're just like that. Really anything. We can go both ways too. So we can get some of that T-spine as long as we're not arching here and moving at the low back, keeping everything tucked. That's what we're looking for. So that's a great exercise to work on getting into that front leg and posting.